Welcome. We're glad you all came out to join us this lovely Friday afternoon. We are here to talk about the Children's Specialty Program. I am Michelle Stafford. I am the Director for SoonerSelect Operations over Medical and Children's Specialty Program. And we have partnered with our friends at Oklahoma Complete Health to bring you this program that we recognize there's a special population with different needs and what we've been able to meet. And they have brought us some really great ideas and some really great benefits for this population, and we're really excited for them to share that with you. So this time I will turn it over to Oklahoma Complete Health.
Thank you, Michelle. I'm going to introduce myself. I'm Nicole Berland. I'm the Vice President of the Children's Specialty Program, and I'm a licensed professional counselor with over 25 years experience with Medicaid. The last 20, the last 20 or so, I was with the Oklahoma Healthcare Authority in the Behavioral Health Department. I was mainly responsible for policy, utilization review, and working with our sister agencies, the Oklahoma Human Services. Oh, you need the mic. You need the mic. Okay. Is this better? It's kind of, well, it's not going to stay. Let me see. Too short. Oh, thank you, Johnny. Okay, better? Anyway, my experience for the last 20 years was with the Behavioral Health Department at the Oklahoma Healthcare Authority. And so I'm really excited about what we're going to be able to do here with the Children's Specialty Program. That's going to be a little bit different and more enhanced than what we were able to do in my previous experience. And next, I'm going to have Johnny Ward introduce himself and talk a little bit about the program.
Thanks, Nicole. My name is Johnny Ward, and I'm the Manager of Operations for the Children's Specialty Program. I've been in my role just over 2.5 years, and I come to this position with 15 years at OCH, well, OHS now, Child Welfare Division. I was a permanency planning supervisor in Tulsa County, and I did manage a caseload of duly adjudicated youth, and that is those who with a deprived and delinquent case. I worked closely with our counterparts at Oklahoma Juvenile Affairs in coordination of priorities for the case, as well as the court team that was overseeing these cases. I'm a former foster parent to many, and I'm an adoptive parent of 3. And I've also helped found the Oklahoma chapter of the Foster Care Alumni of America and still serve as its chapter father. This is just a little bit about us at Oklahoma Complete Health, or OCH, as you might hear us refer to ourselves in these slides. Our purpose, or why we are in business, is transforming the health of the community one person at a time. And how do we do that? We focus on the individual, the whole person, addressing not only the physical and mental, but also those social drivers of health that we know are so extremely important, looking at a holistic approach. We do this in a boots on the ground with employees placed throughout the state. We believe healthier individuals create, more vibrant families and communities. And we believe we have a responsibility to remove barriers and make it simple to get well, stay well, and be well. We believe local partnerships enable meaningful, accessible health care. And this is a footprint of basically our parent company, Centene. This is a footprint of where we are in other states doing this Children's Specialty Program. We are in 22 other states and currently responsible for around 240,000 members. And we did our first Children's Specialty Program in Texas 15 years ago. The eligible populations for CSP include children in foster care, some juvenile justice involved cases, foster care or former foster care up to the age of 26, and adoption assistance cases. And American Indian Alaska Native is an opt-in population. We understand the importance of partnering in order to best serve the SoonerSelect Children Specialty Program population. And a few of our most significant partners are Oklahoma Department of Mental Health and Substance Abuse Services, Oklahoma Healthcare Authority, Oklahoma Human Services, as well as the 39 federally recognized Native American tribes in Oklahoma. And then finally, the Oklahoma Office of Juvenile Affairs. We are connected on a business and technical front with state agencies and want to recognize our integration and understanding of each other's processes. Now I'm going to talk a little bit about the staffing of Oklahoma Complete Health. Our CSP operations team is led by Nicole, our Vice President of Children's Specialty Program. and myself, who I report directly to Nicole, and I'll be managing the CSP liaisons. Our most recent liaisons consist of Angela Jones. There you are. She's our specialty court liaison who comes to us with 15 years of Oklahoma Human Services Child Welfare Division experience, where she worked as a program field representative in Rogers County. And then we have Mike Hader, who's been with Oklahoma Complete Health for a month longer than me, so a little bit over 2.5 years, and comes from Oklahoma Human Services Child Welfare Division with a wealth of experience where he worked as a program field representative in tribal coordination, as well as having worked in foster care resource and permanency planning departments. Mike also worked with the Oklahoma County Juvenile Bureau, as well as serving as director of support programs for the Youth and Family Resource Center. And then we have Valerie Danner, who also comes to us from Oklahoma Human Services Child Welfare Division. Valerie worked as a child welfare specialist too in Tulsa County with a caseload of duly adjudicated youth. She also has experience working in the medical area with companies like Community Care and Ascension St. John. And then we have Carla Scott, who comes to us from the Salvation Army, where she was Assistant Director of Social Services. Carla was a case manager at the Stevenson Cancer Center, but she also comes to us with 9 years experience as Child Welfare Specialist 3 in Oklahoma County. And then we have Nicole Orr, who comes to us from Alara Caring Hospice, where she worked as a hospice social worker. Nicole also worked with Oklahoma Human Services as a child welfare specialist, as well as having worked at the Sequoia Boys Home as a youth life coordinator. We feel very fortunate to have such a rich experience group of people working with this population. We also have 3 more positions that we're filling. They actually, 2 of them start on March 4th, and then we have another one that's still in backgrounds. As we have 7 CSP liaisons, and some of the primary duties that they'll have is they'll serve as primary contacts between the health plan and the child welfare juvenile justice state agencies. They will have child welfare experience and or medical experience. They will advocate and build relationships both internally and externally. They will provide training to help child welfare stakeholders understand how to get the most out of our health plan and how the health plan is here to help them. They will help quickly resolve issues and connect people to the information they need. And they will support our tribal government liaison with outreach, education, and customization of program with tribes and our AIAN members. And this is just a footprint of where the liaisons will be placed throughout the state. We will have Nicole in the Enid area. We have Valerie and another one placed in the Tulsa County area. And Angie Jones will also be in the Tulsa County. We'll have 1 in the McAllister area and 1 in Lawton area, and then 2 in Oklahoma City area. A little bit about our judicial support program. Our specialty court liaison, Angie, this is based off of a pilot program that was a best practice in Texas. And she will be embedded in the Tulsa County Juvenile Courthouse. She will help the court teams to quickly organize appropriate physical health and behavioral health services to avoid gaps in care, service delays, and the need for additional assessments. And working in conjunction with the OHS Child Welfare Specialist Court Liaisons, she will proactively identify children and youth in conservatorship with upcoming court dates and work alongside the court team to mutually align goals for the child and face-to-face interaction with each member's court team and to follow the child until they receive all appropriate services. She will educate the court team on supports for the child, including covered services, value-added benefits, care management services and supports, the nurse advice line, and 988. She will also monitor proceedings in person to deliver more real-time support for the court teams. We originally wrote to this program being embedded in the Oklahoma County Juvenile Courthouse, but after we won the award, we met with Dr. Shropshire, who is the Oklahoma Secretary of Human Services and Executive Director of Oklahoma Human Services. And she asked us to think about placing this program in Tulsa County to work alongside a pilot program that they had with the Oklahoma Legal Aid Services. And so after talking with her, we quickly pivoted and placed this program in Tulsa County. Now I'm going to turn it over to Dr. Keisha Sobers Butler, who's going to talk to you a little bit about care management.
Good afternoon, everyone. As Johnny said, thank you. I am Dr. Keisha Sobers Butler. I am the Vice President of Population Health, Clinical Operations, Health Equity, and really various departments that all support our members. It's always important to kind of level set what does care management do and how I come to the work. I am a nurse by trade, or a doctor nurse, I like to say that, but I'm also a mom of a differently abled young adult. And so through the experiences we've had with her, I always say I became a case manager because I didn't have one. So what I'm going to do today is talk to you a little bit about the Centene's Families and Futures model, and try to give you a little bit more of an expectation or framework about what our program will look like. I've heard some of the comments. I've had the pleasure of going throughout Oklahoma the last couple of weeks with our state partner teams, and a lot of what I've heard is, what is a care manager and why do I need someone else? So the way I try to describe the team that we will have is that they are your chaos coordinators. For many of you in the room, there have probably been times when you've received a placement in the middle of the day and you're not really certain of what's going on with this individual, with this kid, this young adult, and how do you connect to services? Or maybe you know that this particular individual had a relationship with a certain provider, and you've been trying to call that provider to get in to see that particular provider, and it's been a little bit of a delay or a lot of phone calls, and you're running out of steam. Or maybe you have other kids at home in addition to these little ones that you're taking in, and you're like, I don't know where to start. I've been there, as I said before, because I'm a mom. But when you look over here behind me or to the side of me, there are 4 foundational principles that we talk to in our Centene model. Johnny described for you guys that we are a part of a national organization, so we take this very seriously. We're very fortunate and blessed to be able to look at Texas, who runs their full children's specialty program for experience. So in our Family Futures model, one of the things that came out of it is that we recognize we need to provide more than just clinical care. We recognize that kids and young adults don't get better just by virtue of saying you have this chaos coordinator. We need to be integrated with other places and other departments. So the first one is obviously my team, the care management team. We're going to support, as I said before, we're going to give advice if you need it. We may just be a friend to make certain that there are no balls that fall out of the air. The second one is training. We have the pleasure of having a national team that kind of supports us with a lot of specific training. You'll hear me talk a little bit more about what some of the ones that I think will be very impactful to success in the state. The third one is partnership. That's pretty broad. Obviously, we are partnering today with our state partners. We obviously have other state agencies that will be a part of this work. You're also going to hear me speak a little bit about the local Oklahoma provider associations, making certain that we do not bring in fragmented care, that we're looking at this holistically. And the last one that I want to talk to is specialized networks. Within that space, we have a large provider network. I always do these shameless plugs as I move to the next slide. If you have already looked at our website and you've already determined that our providers may not be in there, before we leave today, everybody pretty much on this front row or the second are a part of our Oklahoma Complete Health team. We want to make certain we get to know those names so that we can be ready on 4/1. The next thing that I want to talk about probably looks like a science project. You see a lot of color, especially for you guys in the back of the room. This is really the brainchild about what we're doing when I say care management. I didn't tell you who those people are, but they are licensed nurses. They are licensed social workers. They may be licensed professional counselors. The state of Oklahoma was very clear that anyone that was going to be a part of Children's Specialty Program, as far as helping to do assessments and are developing an integrated member plan, needed to have a degree. So when you're looking at this particular graphic, if we stay on the left side of that graphic, you see 4 bubbles. That's probably all you can see from the back of the room. They're colored pink, gray, purple, and yellow. And what that first column is really indicating is that we will have a fast track approach. As I said before, I've been through the state, and everyone that's been traveling with me, they know that I say this shameless plug right here, and I apologize at the same time. One of the main focuses for me in the first 90 days, as well as what the state's expectation is for us, is to outreach. So within the first 90 days, our care management team will try to contact you. And that's very important as it relates to that first column, because what we're trying to do is complete a health risk screening. It's so important. It's not about us getting into your business and just asking some vague questions. Those questions are there for a reason. And basically, it's our time to start and develop trust, establish a relationship, figure out where you are in the process, because I described us as chaos coordinators. So that health risk screening, you're going to get it a couple of ways. The first way is that we're going to send you at least a welcome letter by mail, and it's going to say, we're trying to get in touch with you. Most importantly, when we're trying to get in touch with you, we're there to try to help and support completing the health risk screening. There are questions that ask everything about, when was the last time you went to the doctor? Are you up to date with immunizations for you or the kid or the young adult you're taking care of? We want to know if you're experiencing homelessness, if you're experiencing any type of food insecurity, if you're having access problems to transportation, if you can't find a provider and network. All of those things are really important. As I go back, because I'm a former teacher, so I always say these three things. I'm going to tell you a lot of stuff in advance, and then I'm going to tell you what I told you at the end. So going back to this left column for the last time, there is something else that comes out of that health risk screening assessment. It is the place where we're going to determine if you belong in what we're considering fast track. So on fast track, as you answer certain questions, it is an algorithm built into that health risk screening. If you are experiencing homelessness, as I mentioned, if you are a young mother that's pregnant or even an older mother that's pregnant, we want you to bubble up to the list so that we can start to coordinate care for you. If you're currently receiving private duty nursing, if you're receiving personal care services, if you're receiving therapeutic foster care, if you're taking care of someone that is in the NICU, all of those big buckets, we want to make certain that we can put you into a category. So I described it as fast track, but I didn't tell you what fast track was to. So it's to the right of the 4 boxes that you see. There are 4 levels of care that we have assigned for the Children's Specialty Program. They range from level 1, being everyone that until we meet them and we do the health risk screening and determine if you should be in level 2, 3, or 4. So the level 1 is on the base. That is a ratio where our nurses, our social workers, our licensed professional counselors, our degreed care managers will have a ratio of roughly 300 to 1. That seems like a big feat, but we have the experience, we have the training to get it done. What they're going to be doing in that 1 base level is at least talking to you guys monthly and doing face-to-face visits every 6 months. That is in our base level. After you get through low and people that we don't know, because everyone goes into that first level, the second level is called moderate. In the moderate level, you guys will still get calls monthly, unless you don't want them, because I heard that in Tulsa. They were like, but what if I don't want, I don't want you to call me every month. Well, we could talk about that. We do want to stay engaged. Remember, we're there to help support you with chaos coordination. So maybe not just say, call me once a year. That may not meet where the state has us coming in. So we'll have to talk about that, but we do not want to overburden you. And as a mom, I do understand fatigue with getting many calls. But in your level 2, the ratio actually drops significantly. Our nurses, our social workers, our licensed professional counselors, and degreed case managers are now managing about 120 of you to 1. And that ratio is a little bit different, just based on the fact that these are individuals that now we know. No one's at the base level. There may be a diagnosis of asthma. There may be a diagnosis of diabetes. So we want our care team to have a little bit closer rein on doing the things that are needed. We will at that time contact you monthly and also do face-to-face visits every 6 months. And those face-to-face visits do not necessarily have to occur at your home. I'm trying to fill this in, guys, with all the questions I've received throughout these presentations. They can be at school, they can be with your provider. As a matter of fact, some of our care team will sit inside of some of our offices that you'll hear me talk about in a little bit. Your 3rd level is high. That's not a bad thing. That just means we need to put a little bit more love around you. We need to integrate with you more. We need to make certain you are on top of all of your providers and be there to support it. In our high, our ratio goes down to 50 to 1. That means that we're spending a lot more time in making certain you have everything you need so that we can really turn around health outcomes and quality for everyone involved. What you'll see is that we're also contacting you at least monthly. It will probably be a little bit more frequently. Perhaps this is an individual that has both a physical diagnosis, like maybe a sickle cell or an asthma or diabetes. And this individual probably also has some behavioral health concerns that we're also addressing at that same time. Could be your ADHD, could be bipolar, or whatever it is. Our teams are trained to manage that and to support you. The highest level is called complex. Again, it's not a bad thing. What I'm trying to do in the first 90 days, as I go all the way back to the beginning of this conversation, is get to know you, do that health risk screening. I mentioned only one way thus far. I said we will do it by mail. You'll also get a call from my team. And then the one that I apologize for, you will get a robocall. And I say that nicely, lovingly. What we're trying to do is make certain that we outreach to you, meeting our contractual requirements of the 90 days. When we call you, either way, if it's by mail, if it's my team calling, and or if you're getting that robocall, we've kind of designed that you press a button, you'll get to a human, you'll get to our care management staff that can help you walk through the screening. But if we go back to that last level, you can see the ratios are down to 30-1. That's a pretty tight ratio for engagement. And part of the reasons is that we're going to be outreaching at this level every 2 weeks. And these are just suggestions as we wrote it, using our national standards. It could be more, it could be less. As I said before, we can be flexible. But what you see here is that we're also doing face-to-face visits monthly. It is a requirement in this highest complex level that we want to make certain we're engaged, that everyone feels supported on what we do in care management. So as a high level, this was a lot to talk about. The things that I want you to take from this slide, because I've thrown a lot of different, I hope I didn't do too many acronyms, is that we are a care management team. On my team, there are 6 directors, there are multiple, at least 5 or 6 managers, and tons of supervisors and licensed staff. Nurses, social workers, professional counselors, degree people. They have been in training. A lot of them are being hired right now. They will be ready on April 1st to outreach to you so that we can start this relationship. So I mentioned earlier that our team needs specialized training. So these are just 1 or 2 things that I want to talk about today. I'm sure all of you in this room have received a call from someone at some point. And sometimes it sounds a little bit robotic. Hopefully no one on our team is going to perform in that fashion. We do use motivational interviewing. And because I am a Texas girl, we use an evidence-based program called person-centered thinking. And one of the things that does is that it takes the driver's seat away from us in deciding what's most important for you. We allow the parent, the caregiver, and or our member to decide that. So when you talk about person-centered thinking training, it is a communication skill where we ask you, what's important to you? What do you hope to gain from this conversation? I did share with you, my team has a little bit of an agenda in the sense of we're trying to get that health risk screening. We're trying to get you to the right level of care. We're trying to do those engagements as appropriate, but it's not just that. It is also the evidence-based training that we're providing. We're also all trained on trauma-informed care. We're not lost by this population. We're super excited that what the state has decided to do in managing this population. We recognize that many will come with adverse childhood experiences. A lot of trauma is built in, so we want to make certain our staff and our providers are trained accordingly to support the efforts. The second one that I want to talk about is training that we can provide to you as you're talking to your case managers. I have to make a story, or stop for a second. I've been calling them case managers, and I do that interchangeably because I'm an old nurse that's been doing it a while. However, I do want you to know in our world, my team is called care managers. And part of the reasons it's called that in Oklahoma is because you will have agency case workers. So if I have interchanged it just because of who I am, know that everybody on our team are considered care managers. So the care managers will provide this voucher to you. It is a place where you will be able to get additional training and resources to support you supporting the kiddos and the young adults, especially related to trauma. So these are just 3 of our programs. Again, because we do represent a team of Medicaid plans that are in the states, we have been able to provide some evidence-based programs for care management, case management. In Oklahoma, these are 3 that I'm highlighting. The first one is our Choose Tomorrow program. What it is if we receive history through claims or even through the conversations we're going to have on the health risk screening, that there is a member that could be potentially more at risk for suicide, we then developed a comprehensive mental health program just around that. So our Choose Tomorrow program is one where our case managers will outreach and then provide that support. The second one I want to talk about is promoting adoption success. We all know the goal is reunification when possible, and we want to do that through the National Institute. So promoting adoption success is another program that we take very seriously in our care management program. And this allows our team to be really well-versed and trained in managing complex populations. And then the third one, I always do a shameless plug here. I mentioned I am the mom of a 21-year-old. I am officially kicked off of any of her health records. Although I may like to be there, she has to give me permission. So what I want to do for you guys in the room is this adoption program, adolescence to adulthood program. We call it A to A, and what it is a program designed for kiddos at 16. And this program is one that the state said, you know, when you think about transition, we know that you guys are going to be on top of transition as it relates to people leaving a physical or behavioral health facility. We know that you're going to be on top of transition for those that may be going from one dental contracted entity to another contracted entity. We feel like you will be on top of transition as it relates to our Native community and those individuals going in and out of receiving services from a care management lens. But what are you going to do about the young adults that are aging out? So one of the things that this program will really highlight, which is definitely a benefit that may or may not be here today, is ensuring that kiddos at the age of 16, they have a health literacy component if they're able, if they're not intellectually disabled. We want to make certain that they're aware that, hey, one day you're going to grow up and mom is not going to be there. So we want to make certain that you understand your diagnoses. We want to make certain that you understand your medications. We want to make certain that you understand that Dr. Jones may kick you out because he sees those kiddos 18 and under. So what does that look like for you going into age 19? In addition to that, our program will also focus on employment, on education, on school, on social. We just don't want it to focus on the health, because when you talk about this program, adolescence to adulthood, it's more than just the physical and behavioral. The last thing I think that I get to talk about are some of the delegated services that we have prepared in this particular contract. The first one is a relationship that you guys may already have with the Oklahoma Sooner Health Access Network. This is one of the programs that we will bring, and it was based on just being in the state. I've been here for about 3 years talking to families and them saying they may get a kid for placement in the middle of the night. This particular kiddo has diabetes, and they are now taking care of a kid, type 1 diabetic, never done it before. They may not have the right tools. They may not know how to manage it. So what the HAN department will, or the HAN, I guess, as a health access network will do for us is provide additional support and education. So right now we know if you're a part of the state agencies, you will have an OHS case worker. I've identified for you, you guys will also have a care manager from our team. This is a third layer, but it is only there to provide additional educational support if that individual has diabetes and they need some more support. If this individual has asthma, which a lot of kiddos do in these parts of Oklahoma. And then the last one is if they're suffering with chronic anemia and or sickle cell, our HAN team will be there to support with that additional layer of education and literacy. The second one that I want to talk to really relates to Oklahoma City, but we are hoping to partner with this particular organization throughout the state. It is through the organization Pivot. If you live in OKC, and I think most of you may, because we're here today, Pivot has done a lot of work thus far with working with kiddos and young adults that are unhoused. So what we have opened up for them is an opportunity for them to do what they're experts at, and that is helping to support individuals that may not currently have placement. They can help and support that. So any referrals that our CM team may get around that, Pivot will be there as an additional layer in the Children's Specialty Program. As I talk for just a brief moment about what Pivot will do, I do need to do a shameless plug about the other teams, just because one of our directors is here. In addition to all the clinical stuff that our teams will have under the umbrella of population health, we do also have a health equity team that will be working and have dedicated employees to the Children's Specialty Program, because we recognize when we talk about health equity, it may not look the same from one contract to another. And then the second thing I'll say is that I do have a director that specializes in those 9 drivers that can affect clinical outcomes. So in our team, even internally, there will be a food specialist, there will be a housing specialist, there will be an education/employment specialist, to make certain that we leave no stone unturned in supporting you and being additive to what you're going to experience coming for one. Now we'll turn it back over to Nicole. Thank you.
Okay, Keisha mentioned some of our partnerships. I'm going to mention a couple more for you. We have a partnership with the American Indian Institute at OU, and they'll provide a tribal kinship navigator program for us. This will be supporting specifically our tribal kinship foster homes, and the hope is that we can help them navigate our system, the child welfare system, and decrease moves for the kids and help to maintain our foster homes, keep our foster parents supported. The second one is our foster care and adoptive parent mentoring program. You may be familiar with that, and Sarah Harrigan is with FCAO. They've been doing this for a little bit now, and we're pretty excited to support them. This is a program that supports our new foster parents by pairing them with more experienced foster parents. They provide supportive listening, helpful input from just the experience that they've had. And the goal, again, is to retain our current foster parents and recruit more. And then finally, we have a partnership with both Sunbeam and the Parent Child Center in Tulsa. This will, they will do for us our infant mental health assessments, and we're going to be able to compensate for up to 5 visits for these infant mental health assessments with the clinicians that have the special training to do those. We've been working to develop our specialized network, specifically recruiting providers that are already serving Sooner Care, that have experience doing trauma-informed care. We are partnering specifically, Keisha mentioned OU, we also have a partnership with their Fostering Hope clinics. There's one in Tulsa and one in OKC. They offer trauma-informed medical homes for children, including those living in out-of-home placement. And then we have our 5 therapeutic foster care agencies that are statewide. And we have our child placement agencies, the Alliance with Mental Health, the Alliance for Mental Health, sorry. This consists of the 7 CCBHCs, or Certified Community Behavioral Health Clinics across the states. And I should mention, we plan to have embedded staff at the OU Fostering Hope clinics as well. Okay, so this is a little bit more of the fun stuff and what makes us different. One of the things that makes us really different from what the traditional Sooner Care that you've had before. This is our value-added benefits. Now, there's a very lengthy list available on our website, and I would encourage you to go check it out, because I can only highlight a handful today. The first thing I'm going to talk about is our enhanced transportation services. So transportation in Oklahoma can be challenging, and not everything is in the metro, or not everything's out in the rural area where you may or may not live, and then you got to get to the city to get there. But our enhanced transportation services are going to cover 5 round trips per member per year. We can do anything from social outings, visits with biological family or our foster kids. We believe this will support reunification efforts with our biological parents for our members. We can cover anything related to our social determinants of health, such as food resources, WIC, childcare, maybe a job interview for a parent who's working their plan to regain custody. We can cover we can get you to your parenting classes if needed. Any of those things that you think might support reunification, those are the kind of idea. That's where we're trying to fill in the gap. We're going to support our biological parents by allowing them to use this transportation service to go to medical appointments. meet the foster parent and the child there, and then they can learn about the child's needs and how to care for them. You can also use this service for our OJA appointments, for our juvenile justice involved youth. Next, we have our tutoring service and GED prep. So most of our foster kids move a little too much. It makes it challenging to stay caught up in school. So we found that we're going to be able to cover some tutoring for them. We'll cover tutoring for kindergarten through 12. And then the GED prep is for our students who are 16 and over and do not yet have a high school diploma. Let's see, Fostering Families Magazine. This is a publication that's going to be bi-monthly. We're going to send it out to all foster families in Oklahoma in partnership with OHS. We'll develop a couple of inserts, a little bit of information from us and a little bit of information from OHS, and we'll get those out to our foster families. Welcome meals. This is kind of fun. So this is to support our first-time foster parents. When they receive their first child placed in their home, we can authorize a week's worth of meals to be delivered to their home. And care grants. We'll provide $150 per year per member to support positive development. And that sounds pretty broad, and we intended it to be that way. We'll cover anything from sports fees, registration, uniforms, hobby supplies, culturally appropriate hair, getting braids for kids, just about anything you can come up with. Maybe the kids want to go to prom, we can rent a tux, help buy a prom dress. Pretty much anything you can come up with that'll support the child. Talk with their care manager and we'll get that worked out. And then we have our FFA scholarships. So in Oklahoma, FFA is really big. We want our kids to be able to participate. So we have a partnership with the Oklahoma FFA Foundation. We'll provide FFA scholarships to high school students to support skills growth for those interested in agricultural careers. And again, there's a very comprehensive list on our website. I would encourage you to look at it because this is just a tiny bit of them. This is a couple of our partners we're going to have in lieu of services, which means we're going to cover their service, which is an extra benefit that's not traditionally covered. Youth Villages Intercept program, we have a contract with them. They provide an intensive home-based program supporting parents and youth. This program's already being used today with OHS Child Welfare, and they find success with them. And then we have Positive Development. This is specifically for children 8 and under. It's an alternative to ABA, and it's for kids who are likely on the autism spectrum. They may or may not have already been tested. They use a multidisciplinary team made up of mental health professionals, speech therapists, and occupational therapists, and they really focus on engaging with parents in their treatment. These are some of our efforts specific to our tribal members. Like, I don't know who said it, Keisha or Johnny, but our tribal members are opt-in, so they have the option to join us, and we hope they will. We have some specific services for them. Oklahoma Complete Health hired our tribal government liaison, Skylar Deal, who's here today. Thanks, Skylar. He has been working since 2021 to build our tribal relationships and learn better what the needs are of this community. I mentioned earlier our tribal kinship navigator program in partnership with the American Institute at OU. We've invested $650,000 over the next 5 years in that program. And we have, okay, this one is our Comfort to Go bags. So these bags will be specifically for our children in custody. We're sending the duffel bags out to the OHS offices all across the state, and they will have personal care items in them, hobby items, and then a blanket specific for tribal members. These bags are with the intent that the kids would have something to put their belongings in when they move from place to place, because often they do not have that. And then we will use our in-person opportunities, such as today, social media and phone calls for educating our Children's Specialty Program, American Indian, Alaska Native members and caregivers on our program, and including the opt-in nature. We're going to talk about how they have the option to opt in, the value of our program, our preventive services, as well as our tribal healing value-added benefit. And we just want to acknowledge and appreciate our partners that have been working on this project with us and that we're moving forward, we're going to be partnering with. All of them listed here, but OK Cares, I want to thank Stacy for helping us to arrange all these town halls. It's been a lot of work and we appreciate you. And then we have, of course, the Healthcare Authority, OJA, Oklahoma Human Services, and our foster parents and caseworkers, as well as our providers. So if you have your phone, I really want you to put this number in. This is our customer service number for Oklahoma Complete Health. This is how you're going to get a hold of us, ask all your questions, reach your care managers, just anything you need. We're here to help. We already have trained staff answering the phones today. They're ready to go. And as far as next steps, if you are the foster parent of a child in custody, your child will be automatically enrolled with us. So you don't really need to take any action. Or adoptive parents, you will need to call the Healthcare Authority and choose option 5. Choose the plan that's right for you, hopefully Children's Specialty Program. And then who have I left out? I think that's it. But I do want to say, I just want to acknowledge that we brought our team today, but specifically we brought Franklin, our CEO, and Christopher our COO, and our Chief Medical Officer. So we have the whole gang here, and we're ready to take your questions. Oh, Dr. Tessa Chesser, I'm sorry. Yes, our Children's Specialty Program Medical Director. Thank you. Yeah, so the whole gang's here to take your questions, and hopefully we can do our best to get you answers today. If not, we're happy to go back and get you the answer that you need. Don't be shy. Okay, so I've been told I have to repeat the question to the best of my ability for the camera. If you're an adoptive parent, you have a choice. That is correct. And she's asking, where do you figure out what the other choices are? So we are specifically the Children's Specialty Program. There are other programs that are not specific to children with these specific needs. It's just the general, I don't know the proper term, we're calling it the core, but I think it's called the medical plans. So we have Aetna, Humana, and Oklahoma Complete Health. We also have that contract for the general medical coverage. And you can go to the Oklahoma Healthcare Authority's website under SoonerSelect, and you can find all those options and compare the plan. It's tough. I'll let Melissa or Michelle come and respond. I've looked at it. There's a comparison chart for value-added benefits that compares the 3 medical. If I'm speaking out of turn, you come on up. But I've looked at it. So there's the 3 medical. You can compare the value-added benefits there. And then specifically to Children's Specialty Program, you need to go click on Children's Specialty and look at ours separately. They were designed specifically for this population, for the kids that have been in the child welfare system or juvenile justice system. Anything else, Melissa? Okay, thank you. Yes. Okay, her question is there any guarantee that all the medical and behavioral health providers that are currently serving Sooner Care, are they all going to contract with the new managed care plans? The answer is no, I can't guarantee it, but I can promise you that our team has been out meeting with providers all across the state, working hard. We got a list from the Healthcare Authority of who's currently serving Sooner Care members, and we've been actively contract with them if they choose to. I mean, they do have a choice, but we're working hard to contract them all. And if they're, go ahead, Chris.
just add a little bit to that. So all three of the
Do you want to come to the mic, Chris?
as unaccustomed as I am to public speaking. No, so just to add a little bit more to that. So all of the three CEs, the contracted entities, that's Aetna, Humana, and ourselves, are working actively with all of the providers across the state to contract them in. There's really very little reason for the providers not to contract with us, and there are a lot of reasons for them to contract with us. A lot of providers are going to get enhanced reimbursement through directed payments if they participate in the managed care programs. So we're working really hard there. Our hope is that we're all going to have a network, all three of the plans, that mirrors what's out there today, and in some cases is even better. Oh yeah, so one of the aspects of this program that the state put a lot of thought into is making certain that there is continuity of care, okay, across as people are moving from fee-for-service into this new managed care program. And so there will be a period for several months after the go live where we will be honoring open prior authorizations, where we will work with you to make certain that you're able to get all the care that was in flight, so to speak, as you're making the transition over. I can tell you that none of the plans are requiring referrals for services. We're working very closely with the state around rules on prior authorizations. The state will be giving us lists of all the open authorizations, so all the care that they've already approved will be coming over to us so that we can start on day one, making certain that we know what's going on with your kiddos.
Correct. So she said if you have a foster child, they're automatically enrolled. If you have an adopted child, go ahead, Melissa. Something else to it?
That's right, and I know there's been a lot of confusion. I know it's very, sorry, I know it's very confusing, but that is correct. Adoptive children receiving assistance they will default to the CSP if a plan is not chosen. And you do have 90 days to change your plan once you're enrolled in one. Yes, yes. Michelle, sorry, I should know that. June 1st to June 30th. They were talking about re-enrollment, that open period, it's state fiscal year, June 1st to June 30th.
So one of the things is that if you are enrolled on the medical side, you'll have an opportunity within 60 days to change plans at the beginning. But then after that period, the first year of the contract will actually be 15 months. So that will run through the end of June of 2025, and that will be the first re-enrollment period will be for July 1st of 2025.
Go ahead.
Sure. Okay. Yeah. So her question is concerning adopted children that also have complex needs but are not receiving that subsidy or adoption assistance. And by the definition of the Children's Specialty Plan, they do not fall into that category. But we do have still the three other two other, because Oklahoma Complete Health also has that core program. So I would advocate you'd work with your care manager of whatever plan that you did choose to best meet your child's needs. And I would mention as well that the CEs cannot be more restrictive in their authorizations or anything than the state is currently. So. Yes, so the question is, the criteria will remain the same across the CEs or the Children's Specialty Program as the state, and my answer to that would be yes. Yes, thank you. Yes, state does have to approve any changes that are suggested or made. Let me think that through. So her question is, because we have addressed this, as you guys know that are caring for this population, very complex, and there's a lot of factors that go into it, and we do our best to try to think of every one of those. So your question is, during reunification, say your foster child is reunified with the bio parent, what happens to that plan? Like where do you go from there? I may have to take that back because I don't want to give any information unless Michelle knows like for sure, because I know we have thought that through. There will be a transition of care, but I to be honest, let me take that back to see exactly how that would work, because I don't want to give any misinformation. Yes. They say
They just get the option into it.
yeah, then they do have the option to opt into the Children's Specialty Program. Yeah.
Yes.
I'll let you.
Yeah. Yes, we do. Up to the age of 26 for former foster youth, which I think that would probably be where they fall in. Up to the 26th birthday. So I want to be clear, it's sometimes you'll see it written as 25. It's through age 25 up to the day they turn 26. Yeah, so is your question, do they get to choose? Do they get to enroll? When do they actually have to choose? I don't know the exact date. So I would assume that they would be able to become a former foster youth if they're in foster care currently, and then they could choose to remain in the Children's Specialty Program up until age 26. And we have that adolescent to adulthood program. So they'll probably be at the very top of our outreach list to get started working with them on transition of care. Correct. Correct. She's okay. I don't know if I can repeat it. If they're an adopted youth that's not receiving adoption assistance, they'll just be in the SoonerSelect plan, and they'll just opt into the adult side of the SoonerSelect, right? No, that's a good question. All these things have to be thought out. Have you guys already thought of that? So they would be able to opt back in because they're former foster youth. Is that accurate? And I want to repeat the question, but help me get there. It was if the child reunifies with their biological family, the family is on regular SoonerSelect, would the child be eligible for Children's Specialty Program? Yes, because they're a former foster youth, and then they could opt back in, correct? Is that correct, Michelle? I can't repeat that. Sorry. Yes. Okay. So what qualifies a child for former foster care youth? My understanding is it's a child that aged out of OHS or OJA custody, and then they can remain on the Children's Specialty Program until they're 26. Correct. That would be an adoption. That would be adoption child, adoptive assistance.
I know, like I said, I know everybody has these questions and there's always something new. So can you repeat the exact question that you had? They were in care. Yeah. Okay, so.
Isn't former foster care, that's children that aged out?
Yes, yes, so
Not
that,
they've
it's
been-
not that I was a foster child at one time and reunited with my family, and we were just having this discussion over here. It is basically those ages of 18 through 25. Yeah. Thank you, Johnny, yes. Again, thank you for all these questions. I mean, I know people have been wanting to know, and so please ask away. Yes.
So our care managers are available on 4-1. And one of the first things, as we kind of alluded to, we're going to do is do that health risk screening and try to figure out where you are on that care journey. You're going to then share with us who are the providers, the multiple specialists that may be taking care of your child or young adult. From that moment, we will then develop that integrated member plan of what needs to happen. So they are available on 4-1. If that child qualifies as a level 4 or the most complex, as we said, we'll be in contact with you at minimum every 2 weeks, and then we'll be making face-to-face visits as well. Yeah. Well, I think it's both. I'm sorry. We start with the provider, and I didn't even repeat the question. I'm a bad student. So the question for everybody in here was, when will the care managers be available to assist with complex youth or young adults? And so my answer was our care managers are available on 4-1. At that time, the first thing we're going to do is that health risk screening to kind of identify where we see gaps in care. We're also going to get a list of all the providers that you're currently using. From that moment, it is conversations in a developed plan together with that parent or caregiver of what needs to happen. One of the other things I want to share, because this is real-time things that are happening with Carolyn right now, for those children or young adults that we have identified are receiving services, be it private duty nursing or personal care services, or if they have a really complex history, those are the kids that we're calling first, so that you're not waiting for a long time after, because we have 90 days to call everyone, and everyone is important. I want to make that clear, but we also want to make certain that those that are definitely seeing multiple specialists, if they're not in network, we want to be working with our PR team to make that happen and to make certain there's no fragmentation. Yes, ma'am. Well, no, the priority is to both. So we are, and Carolyn and I had this conversation this morning. We are also, so to repeat the question, because I'm a bad student, the question was, is the priority just for medical, or will it be medical and behavioral? And I'm clarifying that it will be both. We do have a behavioral health team. Dr. Duncan is not here today, but Dr. Chesser is, as well as licensed behavioral social workers and clinicians, and we will ensure that that continuity of care takes place. Just recapping something that was said earlier as well related to continuity of care for both physical and our behavioral health is that we are ensuring that if any authorizations were in place on 3/31, those authorizations will be in effect until they expire or 180 days. And one of the things we'll do in that first conversation, in addition to completing that health risk screening, is to answer or ask those questions about what's out there, if that's related to authorizations for behavioral and or physical and or DME or durable medical equipment, supplies, whatever is needed. Chris, you had something? Aha. Yes, ma'am. So the question is that there are two individuals that are currently on DDSD, and the question is, will they move over or will they stay on traditional Sooner Care? The answer is yes, they will stay on traditional Sooner Care. I'm gonna say the question, then I'm gonna give it to our state partners. Basically, we've gotten used to having just one name, and that's Title 19 or traditional Medicaid. So how will in the future you refer to it? And our state partners coming up.
Thank you. So I shouldn't say unfortunately, but I think your provider, if they're enrolled and they're contracted, they're going to be aware this was a former Medicaid, case. But you probably do want to be specific in, saying I have Oklahoma Complete Health, or if you've chosen somebody else, I have, so-and-so. So probably best to be as specific, but trust if, even if probably SoonerSelect providers, we're hoping are educated and know what that means. Okay, your question was the all today? Yes. Yes, ma'am. Right, so this town hall, so her question is, she is an adoptive parent, so she understands she has choices from all of the contracted CEs, contracted entities, and asking, did they just decline to come? No, that is not the case. This was specific for the Children's Specialty Program. It is my understanding that the other contracted CEs will be having town halls. I do not have those dates. I don't know that Michelle does at this time, but they should be on our website. Yeah, just keep checking SoonerSelect website, and I believe it looks like Chris has something to say, so I'm going to let him, but I believe all three of them you got. So I'll let you speak.
So I just wanted to go back to the, what do you call the program? So when you get your ID card, once you've enrolled with us, it will say SoonerSelect Children Specialty Program on it, okay? But I can tell you that the member ID number that's going to be on there will be the same as your current Medicaid number. Okay? That may not be true for all the plans, but it's true for Oklahoma Complete.
Thank you for coming. Any other questions? This is very helpful. Obviously, we're all learning from each other too. We're getting a lot of these questions and sorting them out. Okay, well, we will stick around. If anybody is too shy to speak up in the group, we're happy to visit. And we thank you for coming today.